Nikki, thank you so much. I'm going to go ahead and take control back of the screen. But before I do that, I'm just going to invite folks. You don't have to keep on video, but I just want to welcome folks to take yourselves off of video just to give a shout out and a quick hello. If we were, like I said before, if we were in a room together, we'd be small talking a little bit and just an opportunity to connect. And I'd just love to see some faces and get a quick wave. So thank you for coming. Monica, I see that wave. Thank you. Elizabeth, I see that wave too. Thank you. Donna, I saw it. You didn't want to wave, but then you jumped in. I love it. Thank you. I appreciate the energy. The other thing is we're a little bit of a smaller group here. And so, John, thank you for jumping in. It's great to see you. And now, if you want to take yourself off video, go ahead. Relax, sit back. This is a time for you to interact and learn. It's a little bit of a step away from maybe what you normally do during the day. And so I want to welcome you to create a teaching and learning environment for yourself. The teaching part for you is you also have and bring so much experience to this work. Really want to welcome that. And so it's not just about questions in the chat or questions to me for our group, but also discussion or things that you're working on and doing. We want to invite all that in here today as we work together to do this work that we do as best that we can. So with that, I'll go ahead. I'm going to go ahead and share my screen, set that up. I'm also going to set up on my other screen over here to my right, the chat. And this way I can kind of keep an eye on that. I did notice Nikki Monica put in the chat that looks like she was having a problem, I think it was, seeing the closed captioning. So I don't know if there's a way to, in the chat, maybe assist her with that. But we'll go ahead and get started and jump in here. We're going to be talking about mindfulness today and addiction treatment, substance use disorder treatment. This is my contact information. If folks want to reach out to me, this is my cell phone number, my email. I'd love to hear from folks. Please don't hesitate to do that. You can also reach out to me through social media. Or also on my website. And so also, we've been through a lot this last year. That's an understatement. I think what's gone on with the pandemic and also what's gone on for all of us nationally and personally in many of the communities that we work in. A lot of discord, a lot of distress, a lot of social justice issues have come to light. And a lot of times, all we hear about is the negative. And so I'd really like to just invite in the chat folks to type in, and it doesn't have to make sense to everybody here, but just to acknowledge all the folks or some of the folks or one of the folks by name, department, team that help support you do the good work that you do. Just to acknowledge that, just to put it out there so that we can see the support that we have in doing this great work. And so I just want to invite that in the chat. I'm gonna put some folks who helped me today and have helped me in the past invite me to do this great work that I get to do with you all. So Erin's sharing, yeah, I get support from admin, staff, and nurses. That's awesome, Erin. Thanks so much for acknowledging those folks. We certainly cannot do this work alone. So I just invite you to type in who are your helpers. Cindy, yeah, thank you. I get support from all my coworkers, right? This is, we can't do this work without being on a team, right? Family's part of our team too. Family's part of our team to help with work. Absolutely. Family and friends that support me to keep going. Nancy, I love it. Cindy's is Nancy's therapist who provides her support. Love that. That's awesome. Nikki, thank you for that. Nick and Pamela. And Pamela's thank you. Look, it's a love fest between Nikki, Pamela, and I. We're just loving each other back and forth. I love it. All right. Carlos adds in church. John, his wife and daughter, and everyone he works with. Fellow counselors, daycare staff. Yeah, DFCS. Awesome. And Donna says, I get specific support from Mr. Izzo and Donna Young. as well as my other peers. Awesome. Thanks for that. It just feels good to see all that and to remind ourselves that we are not alone. We are not alone in this work. We're not alone in providing this care and providing the support that we do. It does take the relationships and the teamwork that we have. And that's going to be a strong component of what we talk about. Wendy says, thank webinars and readings. Absolutely. I didn't even think of that, thanking that. But yeah, our learning, our education. And Carlos is just throwing it out there, the whole Central Florida Behavioral Network. Awesome. So keep those coming as you think of them. We can't talk about that stuff enough. Great. So what we're going to talk about today in mindfulness is a continuation of the work that you all are doing out there, because this is about continually getting better at supporting and treating people with substance use disorders. And so we really take this approach in taking on and changing the way we think about substance use disorders, the way we practice and treat substance use disorders, and also the people that we serve who have substance use disorders. It takes a combination of all of that. And a big part of our growth in the field is keeping some of the really solid, good work that we've done for decades, and also letting go of some of that work and letting go of some of the old ways that I was taught and how to treat people and treat and practice treating substance use disorders, letting go of some of that as the old way and integrating some of that in the new way, because we do need a new system. And we need a new system that's going to antiquate some of the things that haven't worked so well for us in the past. And so one of the exciting things that's come to the forefront is mindfulness, and how we can utilize mindfulness and its ancient, age-old techniques and bring those into the present as an evidence-based practice to support many of the evidence-based practices that you are also using. So it's an exciting time for us in the addiction field. We've seen the shift and change, the lemonade of the lemon that was the opioid epidemic, where we've seen a greater, broader acceptance of MOUD or MAT, medication for opioid use disorders or medication-assisted treatment. We're seeing the implementation of things like ESPER, where people are learning and training and investing in screening and talking about substance use disorders in places where we never thought to bring it up, like primary care. So we're seeing these exciting shifts, and mindfulness really is a key piece that can help support a lot of this shift in work. And I think it really connects wonderfully to also the movement towards a trauma-informed care approach when it comes to treating substance use disorders. So for us, a definition of mindfulness is paying attention on purpose. We're going to talk about what that means on purpose, and doing that in the present moment, and doing it in a way, and this is key, that is non-judgmental. And so this is from John Kabat-Zinn. He's looked at, as many in this country, as bringing this Eastern philosophy to the West, and bringing it over the last few decades into really our mainstream America. And so the four, there's a lot of different definitions out there around mindfulness, but really I think this is helpful to look at in terms of elements. So 4 elements of mindfulness. The first one is paying attention to experience in the present moment. Now we're going to break these down for a second here. This is exciting because this is looking at the work that we do in a different way. Many times when we are working with a client, we're talking about the past, or we're talking about the future. Sometimes we miss the golden opportunity that is here in the now. So mindfulness starts to give us skills of how to actually talk about what's going on right here, right now, and also bringing our clients skills on how they can pay attention to what's happening right here, right now. We're going to talk about the integration of that. The second element is relating to experience. So relating to experience, whatever that experience is, without judgment and without resistance. So this starts to connect into some cognitive behavioral therapy components, because we're talking about the way that we think, the way that our clients think. And it also connects into a little bit of the concepts that are in acceptance and ACT therapy, acceptance and commitment therapy, where we're experiencing things without resistance. And I think when we talk about resistance, what we're talking about is emotional experience. So the idea that we experience without judgment means that we become mindful of the story that we're telling ourselves, or what it is that we're thinking about what we're thinking, which is kind of a weird statement. We're going to talk more about that. And also without resistance to what we are emotionally experiencing, what we're feeling, what emotions rise in the body, and doing that without judgment. So we're going to talk about skills around that as well. And then the third element, relating to experience with the intention to alleviate suffering. And what we're talking about here is the critical component of compassion, and bringing compassion, for some of us, maybe even back into our work. You know, I was taught when I got out of social work school to actually, in addiction treatment, that I needed to abandon some of the very social work values that I was taught, and also some of my own personal values. I was taught to treat people with substance use disorders in ways that actually broke one of the hallmarks of what we know is the most effective treatment intervention: relationship, right? And I was taught to sometimes fundamentally distrust my clients. I was taught to confront them. I was taught to call them out in ways that sometimes were out of alignment. Mindfulness is reversing that process a bit and starting to not only teach our clients, but also for ourselves, to bring compassion back into our work as a healing element. We're going to talk about why compassion is so important. And then the fourth element, understanding the nature of both experience, so what's happening, and also the experiencer, so the person. And that connects very closely with utilizing a trauma-informed care lens. So we're going to dive into and pull some of these components, pull them apart, and talk about how we can integrate them into our work. So when we talk about mindfulness, in a lot of ways, it's coming to our senses, but coming into our senses, and our senses are one of the doorways to help us into a mindfulness state. And we do that through self-awareness. So the idea is that we give or provide ourselves compassion to allow our emotional energies to flow through. So the idea here goes back to not restricting emotional content, but allowing that emotional energy to flow through us. And so experience and experiencer will become aware of what and how we teach, tell, and internally speak to ourselves, right? So the idea here is that there is a way to separate from our thoughts. The thoughts are kind of what goes on all day long. Like, I don't know about this guy, Nick, or what is he saying? Does this make any sense? Or I don't know if I'm buying this mindfulness thing or not. This is the internal dialogue that we talk about. Being able to become aware of that dialogue helps us, is a muscle that we can build to become aware of what is the story that we're telling ourselves, or what is the narrative here? What is the judgment? What is the evaluation? Is it accurate? Does it come from somewhere else? Is it even my voice? You know, as Nikki and I were talking about parenting before we got started, and I don't know about you, but I know there's some things that I grew up that I said I would never talk to my children that way, or I would never talk to my partner that way. And in the heat of the moment, in an intense emotional situation, there she is, out of my very mouth, my mother. It comes out. So we have narratives and internalized stories that we can identify and separate from. And that's what mindfulness starts to help us do. So it's moment by moment, non-judgmental awareness, not just of what we think, but also what we feel and experience. And how we feel and experience those things a lot of times show up in our body. So our body sensations, right? What it is that we feel, where it is that we feel it. And then some other ways that we get into mindfulness is formal meditation practice. And we're going to talk about some of these techniques, but the idea of a meditation practice, really, it doesn't have to be also formal. It can be anytime that you focus on something that you love, something that you're passionate about, singing music, walking in the park. These are all forms of meditation. Some of the other formal components of meditation, though, are things like a body scan, where we functionally, mindfully focus on different parts of our body. Like right now, I'll invite you to just become aware of your feet. Think about and connect with your mind's eye, your feet. They're there. They've been there all day, but maybe today, right now, is the first time you're thinking about them. And wiggle your toes a little bit. And you can feel them in maybe in shoes or maybe on the floor. Maybe you took your shoes off. And all of a sudden, you are aware of your body and have made conscious part of your body that was unconscious to you maybe just moments before or all morning. And so we can use these techniques to start to bring us into a place of mindfulness. And so the informal practices of just being aware of the present moment by focusing on a flower or something in nature, those are typical ways that informally we do this. So mindfulness helps us establish a sense of self that is greater or separate than our thoughts, than our feelings, and even our emotional experiences. So we can learn to build this muscle of the observer self that helps us peel away and push back with some of these experiences that we sometimes over-identify with and over-authoritize with. We give away sometimes our own internal authority to these experiences. Mindfulness helps us peel back off of that just a bit, create some space so that we can examine, see, experience with a bit of a distance what we're feeling, what memories we're having. And that starts to develop a greater sense of awareness. So for us in addiction treatment, mindfulness can be the catalyst. It can be the conduit to recognizing what is seemingly happening to us when it's not happening to us, or what is seemingly automatic that is out of our control that actually is in our control. Certain emotional experiences, certain behaviors even, and also can be the doorway to being more effective in utilizing some of the evidence-based practices like cognitive behavioral therapy, like acceptance and commitment therapy. You know, we talk a lot, we're going to talk about CBT and traditional relapse prevention planning, and we get concerned sometimes because these techniques, they're evidence-based, but sometimes they don't work. Why aren't they working? Well, are we working with a client whose brain isn't even regulated enough for them to be effectively engaged in a tool that we know is effective, but we don't have the prefrontal cortex online to engage with it? So ultimately, what we're doing is rewiring the brain, and that's what mindfulness helps us do, and it's what we do in addiction treatment. Is that it literally helps us start to rewire and remap many of the disrupted neural pathways. And the great part of mindfulness is that we can do this in vivo, in life, right here, right now, with the client in our session at the moment that they are with us. And a great doorway as a pathway to mindfulness is also using the breath and diaphragmatic breathing, also in becoming aware of your physical surroundings and room awareness, color awareness. We talked about body scanning and also grounding exercises. These are, and we're going to go into some detail around these, but these are the things that help us build the muscle of awareness. And in that awareness, we can also build with our clients awareness of how our bodies hold energy in specific places. So, you know, for me, it's an embarrassing thing, but a lot of times when I do these presentations and when I speak, my hands get really cold because I get anxious. And even more embarrassingly, they also get sweaty. And so for me, that's a body awareness that also I can use as a way to help me attend to maybe what it is that I'm not aware of, where I keep telling myself, I'm going to do great and the presentation is going to go fine and no one's going to throw tomatoes at me or anything bad like that's going to happen. But my hands let me know that, Nick, actually, intellectually, you want to tell yourself you're doing okay, but you're not. You're nervous. So paying attention to my body in that awareness, being mindful of what my body is telling me and what's it holding, I can then use my mind to attend to that anxiety. And then I have some skills that I can implement to use to help me manage my anxiety. The other part of building awareness is being aware of thoughts and being aware of how we think to ourselves. And that awareness breaks the over-identification that we sometimes and our clients sometimes have with the mind. The other piece that's, I think, really a bit of a break from the traditional approaches and sometimes the way that we talk about substance use disorders is about control and power and autonomy. Mindfulness teaches that we do have control, that we do have power, and that we can manifest change. This is not in contradiction to surrendering to a higher power. This is not in contradiction to the wisdom that is held in the Serenity Prayer. It is an adjunct and support to those things. So the idea is that with these new tools, I'm enhancing my ability to understand that there are certain things I can let go of that I'm trying to control and shift into a place of embracing empowerment. So some of the techniques that I think are really helpful that we talked about in terms of mindfulness is grounding. And so we're going to just practice a few right here together. Like I said, mindfulness, the great thing about it is that we can do it right here, right now, in the moment, in vivo. And so I'll invite folks as you're out there to just kind of look into this PowerPoint and this picture and notice and become aware, if you can, of the different shades of green that you can find in this picture. And just by focusing on colors, and you can teach and work with your clients to do this even in a room where they can find the different colors on a wall or shading or on a shirt. Now I'm looking at Nikki's purple shirt and all the different colors on that shirt, right? Those are things, when I focus in on them, we become mindful. As I focus on the colors in this slide, I maybe stop worrying about what emails I'm missing, or maybe I actually stop doing emails and re-engaged in the presentation. I put myself back into a mindful state, slowing down the mind and actually entering into what I'm experiencing in my body. The other thing that's really helpful is focusing on shapes. And so we can look into our slide here and notice all the different types of leaves and the different shapes, lengths, sizes that you can discover in this picture. And just by finding those things, we put ourselves into a mindful state. A great one also to use if you don't have a nice PowerPoint picture or shapes to look at is right now to take a step back and find a corner of the room. So most times we're all in a room where there's a corner. And if you find that corner and focus on that corner, you'll notice that it's a place where two walls meet. And they meet at the intersection of where there's a ceiling. And those 3 points come together. And just by finding the corner of the room and focusing on it, just even for those few seconds, we enter into a state of mindfulness. And even if it only lasts for maybe a second, or 3 seconds, or a few seconds, it resets our brain, it grounds us, it slows many of the processes down that cause us anxiety, that causes distress, that causes some of the trauma experiences that many of the clients that we have are experiencing. And then the last one that we're going to practice, and there's tons of research on this stuff, a quick Google search on grounding exercises. There's tons of stuff on YouTube. You can just search for those things. But the last piece that I really want to introduce is breathing, because it's free and you have it available to you all the time, no matter where you are. And the idea with the breath is that we can empower our clients that we work with to take and bring into awareness something that was unconscious, again, that we were not aware of, into our consciousness. And that right there delivers a sense of empowerment. And so I'll invite you all, maybe you've already done it since I mentioned the breath, that you became aware of your breath. I know I did. And in fact, it's a little awkward right now because I feel out of breath, because I took what my body was doing quite well without me intervening, and I took control of it. And now it's kind of all clunky. And so in that process, we allow ourselves to take control of our body. And by teaching our clients to focus on our breath, we can take that mind's eye, the same mind's eye that I invited you to use to focus on your toes, you can focus it on your breath. And by becoming aware of your in-breath and focusing on your out-breath, we enter into a cognitive technique that actually stops us from generating thoughts. We focus in a mindful state on our body and our breath. We also know from the research that if we can take 3 to 4 diaphragmatic breaths, and we're going to talk about what that means in a second, but if we can take 3 or 4 deep breaths, most people experience a decrease in intensity in whatever emotional state they started those breaths in. And that is a great help for many of us. And so it's why you see athletes do this all the time. I think of a basketball player who typically goes up to the foul line, who's been running around and shooting really well and playing the game well, but goes to shoot a free throw. Everything changes because they're out of the flow of the game. What do? Take a deep breath. The other piece to breathing that we really want to encourage our clients to utilize is to not breathe from up here. But diaphragmatic breathing means we're moving into the space of the diaphragm. And again, there's great stuff. We're not going to go into great detail about breathing, but it's belly breathing. It's breathing from that lower part and bringing that breath in where we're actually not breathing in the upper part. The upper part of our breath, or if we breathe through the chest, actually can exacerbate our stress. It can kind of seem like we're hyperventilating or trigger our hyperventilating. So we really want to kind of move into that lower belly breathing. And there's some great resources on breathing as well. So these are some techniques that we can use together. And so let's go ahead and bring this together. I'm going to invite you, and we're just going to do 3 to 4 breaths to do this together. And then we're going to invite you, as I count it off, to breathe in and then breathe out. So we'll go ahead and breathe in, 2, 3, 4, and then breathe out, 2, 3, 4, and then breathing in from the belly, 2, 3, 4, and then letting go of the breath, 3, 4, and breathing in, 3, 4, and then breathing out, 3, 4, and then one on our own. And so I'll go ahead and come back to the room. I naturally close my eyes a little bit and actually have an experience. I don't know if you did that out there, if you had an experience, but I'd love to hear what people feel. If you want to go ahead and put it in the chat. I know I feel a little slower. I feel a little calmer. And that breathing has an effect on me. And I'm just curious if it has an effect for you too, but it's certainly a technique that can really be helpful. So these are mindfulness strategies that help. Oh, great. So Elizabeth's sharing, she feels more relaxed and more calm. Even just a little bit, this can be so helpful for our clients that we work with. And so the idea here is that mindfulness is the fulcrum of resilience, of building resiliency, where we become more adaptable to utilizing many of the skills that we teach around flexibility for coping strategies. And it's also so great. So Nancy feels more in control. Donna's saying she feels calm. Monica, awesome. So Monica's actually connecting to her body where her shoulders are less tense. So it's cool. I love asking people how it went because I know this works for most people. It really is effective. And what a great thing that we can pass on and work with our clients in a session. If you haven't done the breathing exercise, try it out. You know, practice leading someone through the breath. Practice someone, with someone a colleague, or maybe you grab it, even a family friend, to do the imagery so that you feel more confident and proficient when you are with a client to give it a try. This can be a really great way also to start your sessions, to just start with breathing before you do anything else, because that helps regulate us. We're going to talk about the strength and the power of emotional regulation in just a bit. So also mindfulness is the fulcrum of wellness. So we're rewiring the brain for flexibility and for choice. And so when we talk about regulation, it's the basic strategy for really quieting, slowing down our lower brain. You know, we call about the lizard brain or the reptile brain. And we're trying to get from the lizard brain to the wizard brain. How do we do that? So in regulation, these are techniques that give us the ability to monitor and control our behavior, our emotions, and our thoughts, and altering them in accordance with the demands of the situation. And so the other key piece of why mindfulness is so effective with many of the folks that we work with is because what we know about trauma. And we know if you're working with folks with substance use disorders, most of them have experienced trauma. And so this is a great slide from the National Council and the Opioid Response Network that talks about what happens around the physiological dysregulation as the center for people with substance use disorders and with anxiety. So if you look at what happens, you have a traumatic event, and typically there's a hypo or hyper or hypo arousal response. So that's basically the fight or flight or freeze response that many of you are familiar with. And if you look at the hyper response in the top right box, folks experience and they get stuck on experiences such as anxiety, panic, hyperactivity, hyperarousal, inability to relax, restlessness, hypervigilance. The volume is turned up and it can't get turned down. The opposite is somewhat true when it gets stuck in the off position. We see flat affect, lethargy, a deadness, exhaustion, depression, dissociation. So look at these two boxes. What do we know is a wonderful elixir to medicate the experiences in these two boxes that also has tremendously negative consequences? Drugs and alcohol, right? We know drugs and alcohol are effective in treating many of the experiences that our patients and clients have who have substance use disorders, also that have a trauma history. So helping support and help our patients manage and regulate around these areas are going to be key pieces to our relapse prevention planning. So this is what happens in terms of the hierarchy of our brain development. And this is kind of giving us from our top down, bottom up. And the idea here, you know, the brainstem is our lizard brain, and as we move up, that cortex is really our wizard brain. And the experience or the connections with that is that when we're in our brainstem, we're seeing the impact of things like our body temperature. You know, we're under anxiety. What do you see? You sweat. And your heart rate goes up and your blood pressure goes up. And as we move into the midbrain, we see things like sleep disruption. We see changes in appetite, motor regulation, our arousal. And as we move up to the limbic system, those are our reward pathways, right? So sexual behavior, emotional reactivity. And then in the prefrontal cortex, where we have that beautiful part of our brain where we have abstract thought and concrete thinking. So activation of the stress response system is directly connected. When we experience terror, we are in that lizard brain. When we experience a little bit of a step down from terror, we're more in that midbrain. When we experience the sense of being alarmed, we're more in that limbic system. And when we're calm, when we're alert, we're in the wizard brain. We're in the prefrontal cortex, abstract thinking, problem solving, solution oriented, use of imagination. Where do we want our clients when they're in the office with us? Yeah, we want them in their wizard brain, except because of trauma and also the impact of substance use disorders, many times they show up not because of the situation that they are in or because they're in our office, but because of what's happened to them in terms of their trauma and the changes in neural pathways. So strategies, mindful strategies around regulating, and you hear we talk about it from the top down and from the bottom up. So top down, these are some ways that we can help support our folks who need help getting regulated. So things like journaling, things like senses exercises that we just did, where we used our senses to help us put ourselves into a mindful state. Also things that are going to be very familiar probably to the many treatment approaches that you use, like talking about healthy boundaries, keeping healthy boundaries, making sure that our clients have clear expectations, problem solving. These are the things that we know help. And then from the bottom up. So the bottom up, where we're getting folks and addressing those issues that occur in more of the midbrain and the brain stem. This is when, we're seeing some of that hyperarousal, or folks, patient or client is sweating in front of us, or visibly anxious. Focused breathing, any of those grounding exercises, creating a calming space, anything that's sensory that create a mindfulness experience. Things like music, we know are so effective. And then the third piece that is effective, and it is such an important component, and I think we talked about it really, and when we talked about our shout outs, it's our relationships, right? Our relationships with others. And so things like peer support groups, doing things like vulnerability exercises or empathy exercises, not only puts us in relationship with other, but also back in relationship with self. That's why things like celebrations, recognition activities, all these things are really important components of helping with regulation. And so we bring these specific skills that we can tailor to the very individual experiences and client-centered ways with our patients, but also through some of the evidence-based practices that you are out there using. So making sure that we are using MI, motivational interviewing. And the spirit of MI connects to all that we're talking about here, right? Because it's about partnership. It's about acceptance. It's about compassion, and it's about evoking strength, right? Those are the four tenets and hallmarks of the spirit of motivational interviewing. Doesn't that work great? We know also too that connects with a patient-centered approach. And so making sure that what we utilize and what we introduce is in line with the patient's stage of change and where they're at. We all know, working with our clients, that these things can change by minute, never mind by day or by session. So from the MI perspective, we really bring in a shift in how we view substance use disorders and also people with substance use disorders. It's shifting away, remember, from that old approach where we see deficit, problem, pathology, and this isn't our fault, right? As practitioners, providers, and professionals, this is all we're taught to see. We're not necessarily taught in a strengths-based approach. We're taught to see problems, and then we're taught you got to fix them. Well, motivational interviewing spins that a bit on its head, right? Because if we see our clients as having deficits, then we see them as having a lack of insight. Gosh, I think about how many times I wrote that in a note back in the day. Lacks insight, a lack of insight, or lacks knowledge. Well, if I see someone that way, that means that I put myself in a position where I have to fill that. And that means I got to tell them what to do because they don't have what it is that they need to do within them. MI says, no, that's an old approach. The new approach is a competency, strengths-based approach, where I truly see the person having the capacity to change within themselves. And this is where illicit comes in. When I look at my client from a place of having the capacity to change within, I fundamentally change my role. I change my role from a place of needing to tell you what to do to my role is I need to listen what you want to do. And that puts me in a place where I ask and partner. And that also fundamentally changes our professional experience and our relationship. It enhances our relationship with our clients. You know, we talk so much in trauma-informed care, thankfully, about us, practitioners, burnout, compassion fatigue, exhaustion. Well, if you're finding yourself in those places or up against some of those edges, revisit your approach. Are you coming from a deficit approach or are you coming from a competency approach? And my goodness, it's so much more fun to come from and work with folks around that competency approach. So when we talk about taking these tools, a big part of the work that we do in addiction and substance use disorder treatment is really about relapse prevention, right? We call it relapse prevention. We're trying to kind of let go of the word relapse, use return to use. But and I like to kind of put my own spin on that and really look at as a prevention awareness tool. And we know in substance use disorder treatment that, you know, our work is not just about returning to use, right? What our prevention tool really does is help our patients address the people, the places, the things that activate our patients, that contribute to those cravings, right? And so probably all of you have worked on a version of this where you work with clients, you work with patients to identify those pieces, right? And then look at their beliefs, their emotions, what they were experiencing around those events from the past that led them to using. And then what are those consequences around some of those beliefs and those thoughts? When we talk about mindfulness and incorporating mindfulness into that tool, we look at those 4 components of triggers and activators. So key. Because if we look at those things, we look at what are the behaviors, what are the thoughts, what are the cravings, and what is it that then ultimately leads me to returning to use drugs or drinking. So when we look at this chart that's in front of you, it starts with the trigger, the event. And if we follow the arrows across, typically there's a thought. There's a thought for a person with a substance use disorder to maybe go use. And then they experience a body sensation or experience of craving, which then ultimately leads them to use. That's the typical trajectory that we know people experience with substance use disorders and returning to use. The idea here, right, is that we know there's an exit ramp every step of the way up until use, right? And even after use, we know we can jump back into any part of this plan. The idea is, how do we mindfully become aware of when I experience a trigger, what are some of the behaviors that are going on for me? And when I have a thought, what are some of how do I become aware of some of those thoughts? How do I detour off of thoughts to go use drugs to thoughts to stay sober? When I have a craving, instead of satiating that craving potentially with a drug, what are some other ways that I can ride out or ride the wave of that craving? And so in mindfulness, it teaches us it's not just about understanding those cues. And that's sometimes the trap that we fall in our relapse prevention plan, and sometimes fall short with our clients. I can have a whole list of these things. I can list out all the behaviors. I can list out my personal relapse triggers. But if I'm not aware that they're happening, then I can't use my skills to intervene. And so awareness becomes our key here. And there's this great quote from Viktor Frankl, and he says, between stimulus and response, there is a space. And in that space is our power to choose our response. And it's in that response lies our growth and our personal freedom. So between stuff that happens and our response to those stuff that happens, sometimes that feels like it's happening to us or it's automatic. But Frankl's saying, no, there's a space in there. And that's where awareness comes in. How do we gain the awareness to find that space so that we take control over that response? So that response isn't just an automatic reaction. And there's 3 keys to it. We can do it through our mind, through our body, and through our actions, what it is that we do. And so thinking about with our clients, what is it that I'm telling myself? What am I thinking? Do I want to stay with that or do I want to change it? Sometimes we get awareness through our body, right? So what am I experiencing in my body? Where am I experiencing it? What is it that I'm feeling? And my actions, what is it that I'm doing? So our mind, right? it's really helped support that internal dialogue, and through awareness, becoming aware of that. Is my voice negative? Is it positive? Am I using terminology that puts me in a victim place or a blaming place? When I use words like they instead of we, when I use words like they, I exclude myself from the situation. We is inclusive. When I use words like should, must, have to, I've pinned myself into a corner because that's absolutistic thinking. Or is it catastrophic thinking? We hear this in substance use disorder treatment all the time. Reduction of options, where there's nothing else to do but use. That's absolutistic or catastrophic thinking. And so the idea is that through compassionate detachment, we can compassionately attend to these things and slowly start to detach from them. And so it's critical that we also support our clients in being gentle with ourselves and bringing in compassion around this, right? Typically, for most of us, the voice that's inside is harsh. It's negative. It can be punitive. A great thing to ask your clients is, would you talk to a friend like that? Would you talk to your children like that? Would you talk to someone that you love? Well, what are you saying to yourself? How are you talking to yourself? And to remind our clients that you are not your thoughts. You are much more than your thoughts. You can separate back and see your thoughts. And you can stop your thoughts. And letting go of the judgment by holding the thought, thanking the thought, and then letting it know, hey, thought, we're not going to go that direction. I got this. I'm going to handle this. So the idea is that we can dispute some of these thoughts. We can literally change them and reframe this dialogue into a place of resiliency, where crises are turned into challenges. We learn how to take lemons and make them into lemonade. The other piece of this, though, isn't just about cognition. It's also about really being able to attend to what's going on in our body. And sometimes, better than the mind, the body knows. Sometimes you hear it, the body knows best. So teaching our clients, what is it I'm experiencing emotionally, right? I always know I'm in trouble. My wife will ask me, Nick, how you doing? When she knows maybe I'm not doing so well. And I say, I'm fine. Oh man, when I say I'm fine, it's like, okay, check, I probably am not fine, right? And when I say I'm fine, right, I really believe I'm fine. However, maybe I'm saying it like this, and I'm wound tight as a drum, and my shoulders are scrunched up to my ears. And so my body is also letting me know things are going on that maybe I'm not aware of. So attending to things like, how's my breathing? What's my temperature? Are my armpits sweaty? Do I have a stomach ache? Do I have a backache? The body sometimes can help us understand what we're experiencing better than our mind can. And if I have the strength and the ability to become aware of those things, then I can attend to it. This is one of the problems that we see all the time in anger management. We teach folks how to walk away, how to cope with anger, how to deal with anger. But sometimes we fall short on helping our clients experience anger and know that they're angry. How can I use those skills if I tell myself I'm not angry? So we got to be careful of that, because that's a key piece to mindfulness is bringing those pieces in. So some body tools for gaining an awareness really is that emotional resiliency and flexibility, builds that emotional adaptability and understanding too, when we experience those emotions in the body, that we know it's our thoughts that generate that potentially negative emotional experience, but it doesn't work the other way. I can't use a cognitive approach to change an emotional experience, meaning I can't use my thoughts to change what it is I already feel. So when our clients say things like, well, I'm not going to let that bother me, or I'm not going to let that person take up space in my head, there's a tricky, slippery slope around that, because we can intellectually be telling ourselves, I'm not going to let that make me angry. And yet the body still holds anger. And so how can we let go of an emotional experience that we invalidate with our mind and tell ourselves that we don't have? That leads to things like swallowing emotions, suppressing emotions, exhausting ourselves, holding these things inside, trying to make myself smile when I'm feeling angry, and we don't attend to that emotional experience. So that can be such a key piece that mindfulness helps us enter into through awareness with our clients. And then the final key is through action, what it is that our clients are doing. So looking at patterns, speed is a great one, right? So moving quickly, moving around quickly, the tone of voice, all these things help us gain awareness of a potential imbalance that needs to be attended to. So Nikki, I'm just gonna check in on time because I know we're going till 2:30. Is that correct? And I just wanted to make sure that we're okay with, okay, great.
Yes, 2:30.
I also just gonna take a pause for a minute because I've been talking quite a bit I just realized my actions were fast. I slowed down when we did the breathing exercise, and I've gained, I think, some momentum and speed. So I wanna be aware of my body signs and my action signs here, and just check in to see if we have any comments in the chat, or if folks wanted to provide any feedback. It looks like we're okay on the chat, Nikki, from folks. Okay, cool. So I'll keep going, and then if folks want to contribute or add in on that, please go ahead and do so. So really mindfulness, right, comes back to a base of how we can better utilize many of the skills that we've been using, like motivational interviewing, like relapse prevention, prevention planning, as the fulcrum of resilience and as the fulcrum of wellness. And so this also just really brings back into the neuroscience of what we know happens to people with substance use disorders, and also by conditioning, like why we do what it is that we do. And we know that our experiences cause our neurons to fire in the brain. Like you're attending this webinar and your neurons are firing. And the more we repeat those experiences, the more those neural firings occur. And with that, we know that the neurons that fire together begin to wire together, meaning that those pathways get stronger and stronger and stronger. And that starts to lead to why the more we work with our clients with this stuff, the more effective it becomes, because it starts to strengthen those synaptic connections. So the connections stabilize in our neural pathways, and you're literally helping support your clients repair those perturbed pathways that occur from substance use disorders. So literally, because of the science that we now know around neuroplasticity, we understand why the age-old ancient techniques of mindfulness work, because we're growing new neurons, we're strengthening those synaptic connections. You're myelinating pathways for faster processing. Basically, you're building bandwidth in your head, rebuilding brain structure and reorganizing the functions of those structures. And you can do this, this helps support all of us. And we know the impact that this has on the brain, right? And we know what we've taught about what drugs do to the brain has been wrong, right? Nikki's seen this slide too many times because I always throw it into my slide deck because I love it, because it reminds me of like how, we tried to scare everybody not to use drugs and alcohol, right? And if I don't know if you put in the chat if folks remember this, but this was always a big commercial back in the day, right? Where they'd fry an egg and say, look, if you use drugs, your brain's gonna fry. We know that's not the case, that it's much more complicated than that. But and we could dive into this. Maybe Nikki will invite me back for another webinar we can do on this slide alone, because we could talk all day about it. But the idea here is that in this bottom part, this is a slide of this bottom part of the slide here, is that these are I'm going to get my pen out. I just need the pen for this one. Hang on one sec for me, please. So this shows the neuroadaptations that occur in the brain, meaning the brain changes all the time, especially when we enter into the body, drugs, and alcohol. And so these shifting drivers are occurring from neuroadaptions. And so for a person with a substance use disorder, what starts out feeling euphoric when they first start using has long since passed. And so over time, that turns into needing to use the substance just not to feel awful. But for a person with a substance use disorder, it's not just about the drug. In fact, for addiction, it's not about the drug anymore, really. Those neuroadaptions also occur in the things that used to make us feel good. And so that's the hijacking part of the brain that's so upset. I'm going to go ahead and just give me a second while I erase the slide. I'm going to clear all the drawings and go to our next slide here. Ooh. Because what's happened in that prefrontal cortex, and we talked about regulating that part, right, is that decision-making and impulse control part of the brain are getting hijacked. And the other part of the brain, that limbic system, which is basically Maslow's hierarchy of needs, it's getting flipped upside down and robbed. The things that make me feel good, like parenting my children, eating pepperoni pizza, being in relationships, having sex, going to church, I don't feel good about those things anymore if I have a substance use disorder. In fact, I don't get any pleasure. The dopamine system has been robbed. And so why is that so important? Well, it helps us understand that what's happening for our clients, it is not because they don't care about their children. It's not because they don't care about God or love their children or want to go to church. It's because what's happened because of the changes in the neuroplasticity of the brain. These cognitive effects of substance use disorders literally impact things like memory, my ability to remember time, places, people, places, things that used to give me pleasure. It impacts my emotional processing and my executive functioning. So mindfulness, we know, is connected to exactly helping us out with repairing those very parts of the brain. It's also why we want to utilize things like medication-assisted treatment. To keep it simple, though, as we often like to say in the field, addiction is the loss of voluntary control, despite harmful consequences. So mindfulness brings in things like compassion. It moves our field away from the idea that if the consequences get heavy enough, if I truly hit rock bottom hard enough, then my client's going to wake up and change and want to enter into recovery. And we know that's just not how addiction works. It's not what happens in the brain. It's why our criminal justice and punitive approach to punishing people and the war on people, not a war on drugs, has such a negative impact on our communities. And that's one of the things I love about mindfulness, because it brings compassion back in. So there's another piece to this, though, and it's complex because, so who is the change here? Are things happening to me, or is something else going on? And so given the neuroplasticity and choices of self-directed neuroplasticity, who we are and how we cope with things, it's our responsibility, right? This is fundamental in how we talk about many components of personal recovery plans. It's the idea of reinstilling that internal locus of control, meaning I have autonomy and control in the environment that I am in, and I am resilient. And we know that this is shaped by our experiences. The brain is literally shaped by experiences. And because we have a choice about what experiences we want to use to shape our brain, we have a responsibility to choose the experiences that will shape the brain toward the wise and the wholesome. And I got a little problem with this too, because it's not that easy. What about trauma, right? And it's also not our client's fault. We teach in trauma-informed care. It's not what's wrong with you, it's what happened to you. And so we have to find a way of bringing in this duality into our treatment approaches. The old way of thinking in cognitive behavioral therapy is that there's an activator and there's a consequence, right? And we know that we have to bring in the cognitive piece of that belief, because understanding what happens to a person with substance use disorder is understanding that, one, can they control it? And did they cause it? And the answer many times to that is no. And so it's bringing those pieces together for us. And that's why the approach of mindfulness is so important for us to start to think about incorporating, because it builds on things like relationship. It builds on things like the components of recovery. And so I'll just ask, does anybody recognize this? Nikki's also probably tired of seeing this one too. It's a different version of this slide. But does anyone recognize who this is a picture of? I got a heart there. Great. Maybe you could take yourself off mute and shout it out.
We have Wizard of Oz in the chat box.
Yeah. Oh, yes, Wizard of Oz, right? Yeah, great. So this is returning to Emerald City. That's right, Aaron, right? And so I love this picture. Does anybody know what Dorothy and her 3 friends are walking through here? Poppies, right? And this is amazing in a lot of ways to bring up, right? Because how old is Wizard of Oz and how prevalent drug use is in our culture, right? It's no coincidence that those are poppies. And does anybody remember before we got back on the road here? We went off the road a little bit. Dorothy went off the road a little bit, right? She went through the poppy field, and what happened to her? You can just shout this out if you want. She fell asleep, right? Yep. Donna's on this. So Donna, yep, fell asleep. Anyone remember how she woke up?
Was it snow?
Yes, it was snow. Right? So the Aaron, the bat monkey. I totally remember the bat monkeys too, but no, it wasn't the monkeys. It was the good witch Belinda, is it? I think Galinda, something like that, makes it snow. So basically, Dorothy got a speedball, right? Because what's snow a metaphor, right? So it's just another example of how this is ingrained in our culture. Hopefully, we're not ruining Wizard of Oz for anybody's wonderful childhood memories here. But the idea, right, I think this picture comes back to is that all Dorothy really wants to get back to is home, right? She just wants to get home, and she's got to go see the wizard to get her there. And it's a great example too of what it takes, right? Because when we talk about substance use disorders, it is about the brain. It is about the scarecrow of what happens to the brain for a person with addiction and with a substance use disorder. But it also is about the emotional experience too, right? And how recovery is not any one of these components, but it's about bringing the brain together with our heart and our emotional experience. And then the resiliency and the courage of a lion, right, to get back home, and to bring these 3 pieces, these 3 legs of the recovery stool together. It's one of the key pieces, I think, of how we need to integrate. And there's no one right solution for any right, no wrong door, no right solution. It's bringing all these pieces together in an individualized way for the clients that we serve. And so, as we think about this, taking a step back of what we know now around the science of substance use disorders and using trauma-informed care lenses to now see the work that we do with the clients that we work with, do our treatment approaches, do our policies match the science and the evidence base behind substance use disorders? In a lot of ways, in a lot of places, they don't. They need to evolve into that. And so what we're talking about ultimately is this shift in how we treat substance use disorders. We've seen great advances in this. We see the dramatic changes from DSM-4 to DSM-5. Can you believe in 2013? I think that's when the switch was made to DSM-5. Maybe it was 16. I'm blanking on that. We didn't have cravings. We also used the word abuse. Nikki brought out language. How language changes the way that we think. The way that we think changes our brain. The way that we think and we change our brain changes our behavior. And so just by changing our language, we can make an impact. And so you getting away from terminology like abuse and incorporating things like substance use and the shifts and changes that we've seen in the Surgeon General's report around substance use disorders. So really, we're talking about not just changing how we treat substance use disorders, but how we change how we treat addiction, but most importantly, how we treat the people who have substance use disorders. So that's gonna bring me to the end for today. I wanna thank you all for being here today. And most importantly, for doing the work that you do. I hope that there's just something in here today in our time together that helps support you in doing the critical work that you do in your communities, doing this hard work. And so I hope you hear me when I say thank you. And I think we got some time, Nikki. We'll go ahead and maybe open it up for some questions or comments or thoughts about some of the things that we talked about.
Thank you so much, Nick. Just a great job as always. To our wonderful attendees, please come off of mute if you have any questions or even any comments about that Wizard of Oz, story. Because I remember when I first heard it, it blew me away. But if you have any questions about our presentation today, Nick would be happy to answer that. Or if you all want to just dialogue with one another about mindfulness, how is it beneficial to you? Please come off of mute. And we'd love to hear from you. And we were going to thank also, while we're waiting to see if anyone wants to share or have any questions or comments, we thank Ms. Pamela Lee for being here with us and assisting my colleague. Today, she has entered the GIPRA evaluation link in the chat box. So please, before you exit today, we'd ask that you complete that GIPRA evaluation. It allows us to be able to continue to receive funding to provide you all with free training and technical assistance from SAMHSA. So thank you. Anyone, questions, comments?
Hey, this is Erin in North Carolina. I'll ask you a question. When I was thinking about 2 points, we're talking about mindfulness, but we were also talking about language, and I'm wondering how you think the term denial kind of fits into both. Like, 1, how we think about language, and 2, how do you address, or do you address denial through mindfulness?
Thanks, Erin. It's a great question. A lot of the very things that I was taught as a practitioner that I was taught to focus on, actually, we now know are not even evidence-based approaches to addressing substance use disorders. And so we know that, defensiveness, manipulation, lying, from early in my career, I was trained to quickly identify those things and address them, and even come from a place to assume that, the cliche, that how do you know, and this is not my words, but how do you know, we would say the word addict, how do you know when an addict is lying? And we would say when their lips are moving. And we know that those things are not true. There's no evidence base to support those things. And so your question about denial is a really important one, because it is a component for some people who have addiction, that they do not have an awareness around the impact that their substance use is having. Or they're not ready to talk about it or willing to talk about it. And so I think a great way for us to work around and with denial is not in the way that I was taught, which was to confront the denial, but to really come into it from a perspective from our spirit of motivational interviewing. And rather than fight the denial or expose it, how do we align with it? How do we join in that? How do we use a client's own discrepancies to help them gain the awareness so that they too can see what it is that we see? And so there's, I think, some great opportunity of being able to use some of those skills in strengths-based way, where we maintain the most important part of our treatment approach, which is our relationship with our client. And sometimes that means aligning with things that maybe we think are really important to point out, but the client doesn't. And we now know the value of not jumping that really looking at what stage of change is the client in and aligning in that stage of change. Because guess what? That's where the change is going to happen. And if we let go of what we think our treatment plan should be and what the client's treatment plan is, then we know that change is more likely to happen. And we also know if change happens anywhere, it's more likely to impact the entire system. And that gets us more on the trail, I think, of going where it is that we hope to go with a lot of our clients.
Can I say something?
Please.
Pastor Carlos here with I am a person recovering from trauma. And actually, I just had surgery, big surgery, cervical. I'm trying to let myself show, but I have problems with the technical in my computer. But I'm still in recovery. I have a neck brace that I have to have a support. But anyway, in my recovery from May 24, I'm going to real quick tell you a story about that. I went to my third week follow-up, and this neurosurgeon was not happy with the presenting symptoms. And then I'm coming back home and said, what did I do wrong with my, what did I do? That I lift, that I moved? And physically, I did not do anything wrong, but as a pastor, I also have the collaboration of the spiritual, pathway, recovery, different pathway. My spiritual relationship with God is important. And then I felt that it was not that I was doing nothing wrong, but it was actually my mind was not in the game. My mind was not in the recovery. And just thinking about, when I come back to church, what the things that I do also as a practitioner, and I coach people, so my mind was not completely in the recovery. And from the point that I realized that, and I got my mind in the recovery, mind, body, and spirit, I began to listen more what the body was doing or not doing, in the sense that I'm not supposed to do anything physical, but I had to have my mind to be in the recovery, and things begin to change drastically, including that I started visiting a psychologist to help me more on the mindful. And then the whole collaboration of all the providers that I needed to include in this, I began to see a lot of changes. And I'm still in recovery, but the whole approach. So also I was listening to webinars. That the only thing that I could do, and as a coach, this is where I'm coming from. I'm trying to. Is that you mentioned about bringing back compassion, which is it's the combination of the person you're coaching and also yourself, your experience, to bring back compassion. Sometimes we've been pounded so much on the MI, that patient-centered conversation, be an active listener, show empathy, but the patient-centered conversation, you're listening and you just not participating verbally. You just you have to watch out for body language. You need to show the presence to the client that you're there. You so much concentrate on the client that you don't participate. You don't share much. And you mentioned to bring back that participation and experience to the experiencer. That's been hard, because again, you're switching from old traditional way approach to new traditional way approach, and now come back to some of the presenter or some of the coaching, and that's why I take over. That's why I'm going to take away from this, because we have swung from one extreme to the other, and we forgot about ourselves. That our experience is also important in helping the person in addiction and in trauma.
Carlos, thank you. You said so much in your feedback, and a couple of things I take away from what you said is this really does need to be person-centered work, right? Maybe I work better top down in regulating, and you work better top up. Maybe I'm a little bit better at focusing on my body, and you're much more comfortable focusing on what it is that you're thinking. the key is that, you know, we really focus in on what it is that the strength is coming from the patient, the client. And so thanks for sharing that. It's really helpful to hear you talk about it from that, also from that personal experience. I also just wanted to check back in. I forgot your name, who asked about denial, and to see if I answered that question okay, or if there were more thoughts around it.
I think it was Aaron.
Was it Aaron? I'm sorry, I forgot who it was, Aaron.
Maybe she can't get back on.
Okay.
I'm sorry. I think I got what I needed out of your response, so I appreciate that.
Okay.
Yeah.
It was a great question, and there's a lot of complexities to all of what we're talking about, Aaron. So I just wanted to make sure that that I was getting close to what it is that you were asking about. So thanks for checking back in on that.
Yeah.
Cool. So Nikki, maybe we have time for maybe one more comment or thought before we go ahead and wrap up.
Yeah, anyone else? Feel free, comment or question.
And if not, is anyone using this stuff? I know you are. You're doing versions of it out there. I'd love to hear from you. What are you finding effective, not effective? You only have a minute, but maybe in a minute you could share with us.
This is Erin again. I have tried to teach a little bit to patients, and I guess this is kind of more of a question, like what do you think is the best way to pitch it, you know, like as a coping skill?
That's a great question, Erin. You know, I love doing it with my patients, my clients. So the cool part about a lot of these things is you know, especially some of the grounding exercises with mindfulness, you can do it with the client. Like we can breathe together, like we all did as a group. You can start your session with that sort of thing. You can invite them to do some grounding. You both can find the corner of the room. And I find it makes me a better clinician because it helps regulate me too. And so joining in that also creates a level playing field, a partnership. There's a shared humanity in all of us grappling with this stuff. And I think that's a great way to go with it.
Great, thank you.
Yeah, thanks.
And definitely I'll add too, Nick, for me, the breathing helps me so much. You know, I was told by someone, you know, at any point of the day, you know, it can get difficult. You know, you can start your day over. And a part of me starting my day over is I take a moment to do the breathing. If I can't, you know, cut the music on to help me to get into that soothing place, you know, taking those deep breaths in, exhaling slowly, and then getting an image of positivity as I'm doing that. I find that truly is helpful to me. So that breathing, you know, we can do that in the car. You know, you can do it at your desk. You can do it and teach your kids, you know, your family members, because it helps us to focus, right? Because when you're in that fight or flight place, you know, there's no processing at that time. You need to calm down so that you can think about it, and your decisions will be healthy ones. So
you know, yeah, Nikki, just last thing, and I know we got to wrap up, but you know, I hear it a lot of times, and I've said it myself, you know, we say to our clients, patients, what's going to be different this time, especially those that have returned for the X amount of time that they have. And that's the wrong question for us now. We know that now. It's what do we need to experience, right? Like this is not an intellectual only process of recovery. If it was just about learning this stuff, then we wouldn't be where we are with the overdose death rate, right? So mindfulness helps bring back a component that has been missing, like the many components of what we talk about substance use disorders. And so it's an exciting opportunity to open up your practice in some different ways in how you work with your clients. So I hope you'll try some of this stuff out.
Thank you so very much, Nick. We appreciate you as always.